Hi everybody, it's Adam with HeartValveSurgery.com, and we're at the American Association for Thoracic Surgery meeting in Chicago, Illinois. I'm thrilled to be joined by Dr. Eric Roselli, who is the Chief of Adult Cardiac Surgery at the Cleveland Clinic in Cleveland, Ohio. Dr. Roselli, it is great to see you again, and thanks for being with me today.
Of course, Adam. Always a pleasure.
Yeah, so we're here at AATS, a lot of great information, new research is coming out. We're also getting questions from patients coming in at us from all over the world.
Fire away, man.
Yeah, this one is your specialty. Coming in from Sharon, she asks, is there any new research about how to delay or stop the progression of aortic stenosis? Can you tell me anything about ValvoSoft, or what about HMR 1766?
Those are a couple of investigational things. What we have looked at is some of the more straightforward sort of questions that have been around, that we know risk factors for aortic stenosis mirror the risk factors for coronary artery disease. So for a long time we thought, well, manage your overall health, cardiovascular health, make sure you take your statin and treat your lipids, cholesterol well. Interestingly, when they did studies where they randomized patients to really aggressive statin therapy in patients who had aortic stenosis, randomized to either get it that way or not, the patients progressed to need their valve replaced at the same pace. But the patients who had the really aggressive statin therapy were less likely to need bypass surgery at the time of the valve. So we know that therapy is good for coronary disease, even though the risk factors mirror each other, probably not exactly the same process on the valve. And so there's been a shift in direction, like what else can we do? That medicine, Ataciguat, it's in clinical trials. It targets a different mechanism of the kind of calcified plaque formation on valves with the thought that maybe it'll slow it down. That's all I can tell you right now, because there's no data available. Certainly they've got good theoretic science behind it, maybe some animal studies. And keep asking those questions, Sharon, because I think we're going to see more and more new data around it. The problem is, a lot of times when we identify someone with a bad aortic valve, the process is already pretty far gone. It's like a pretty severe late stage. Once you have calcium, it's pretty late stage disease. Now there's this other things, this like ValvoSoft is a mechanical tool that goes in and sort of breaks down some of that hard calcium and stuff. And the thought is, you get to make the leaflets more mobile, then you can ride your own leaflet out a little bit longer. That's also in trials. I don't know of any places in the US doing it. I think they're doing it in Europe. We'll see. That could potentially buy you some time. It may end up being a tool that also maybe helps physicians to, break down some of the disease process and make someone more amenable to a transcatheter valve. Still really, really early, not ready for prime time, but keep doing your homework, Sharon, that's awesome. But also don't be afraid of, when you get to the point where you need your valve replaced. Remember that the whole question, we focus on valve, HeartValveSurgery.com, right? It's all about the valve. It's not the valve, it's the heart. The heart valve, the heart comes first. So you need good valves to have a heart that's healthy, that allows you to have it working well for a long lifetime.
Great. Well, Sharon, I hope that helped you. I know it helped me. And Dr. Roselli, as always, thanks for everything you and your team are doing at Cleveland Clinic.
Of course. Thanks.
Hi, everybody. It's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel, watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.